even up to 90% of endurance athletes, especially, but up to about 60% of any type of athlete has experienced some form of gastric upset. And I got about that number on Instagram, my survey of 300 Instagrammers. But yeah, about 60% of them said that they'd experienced some gastric upset. Seems to be more prevalent in endurance athletes and females, and especially is associated with heat or psychological stress. So even if we're looking at people who may not be athletes, but are, doing like a military exercise, they can experience increased gut permeability, even without the athletic side of things. It's just being highly physically active in a really stressful environment seems to increase gut permeability. So there are a few different theories as to why that is. There's obviously mechanical trauma that's occurring in the gut, so there's a lot of jostling going on. Exercise increases or speeds transit time, so the foodstuffs are moving very rapidly through the intestines, which is obviously going to be increasing friction and then decreasing the time that bacteria have with those nutrients. Then you also have shunting of blood flow away from the intestines into the skeletal muscle, to the working muscle. And so we have reduced blood flow and reduced oxygen availability. And so that just kind of changes the metabolic environment for the bacteria. So some bacteria, well, all bacteria can readily ferment, carbohydrates or they can ferment in an anaerobic environment. That's fine. And then some of them are facultative anaerobes, so they can do things with oxygen as well, and so they can flip back and forth. But you could, by changing both oxygen availability and pH, be supporting the growth of specific bacteria over others that may not be as happy in an acidic environment. And we see that even as we're going from stomach to the large intestine, both diversity and overall numbers of bacteria increase because we have decreased acidity. So those are some of the theories behind why we might see some gastric upset, because basically, we have lack of blood flow there, we have lack of oxygen. We do see that there aren't so much there's very limited literature, I'll say, about this too.
Yeah.
But looking at like the acute effects of exercise, it looks like we don't see so much a change in the bacteria themselves, but perhaps a change in their function and their gene expression. So it looks like they don't focus so much on energy production for themselves, but flagellar assembly and chemotaxis. So I almost envision them like, are they trying to like hang on? They're like, oh my goodness, everything's moving around so much, hang on and try to hold on for dear life. But there's just not a lot known about that. And once again, we're looking at the feces of these individuals rather than what's going on actually in the gut.
Right.
So those things can all change the environment inside the gut. And then, but you were right that over time, when we look at the chronic effects of exercise, that we do see decreased markers of inflammation, and we see overall an increase in diversity in the gut, and we see an increase really in what I'm seeing. I've been looking for trends because we're so different in how we're studying these bacteria, but I'm trying to find what's common between a lot of these studies, and it looks like it's the increase in butyrate producers. So butyrate is a short-chain fatty acid that's produced via fermentation of fiber. And that's very beneficial for gut health and may actually be helpful in increasing insulin sensitivity as well. And now, that being said, it's not necessarily just a factor of exercise. It could be also a dietary thing too, because most endurance athletes are eating a diet that's high in carbohydrate and high in fiber intake. So
right.
It's hard to parse out, the effect of exercise alone versus the effect of exercise versus diet. And once again, like I said, there are so few studies on this, and everything really has been done in endurance athletes. So we've got a couple studies that were done in the rugby players. I think a lot of people are familiar with that. Cyclists and so amateur marathoners. There have been a couple that have looked at just just healthy people who are sedentary, but stratifying them by cardiovascular fitness level, and then looking at how that is related to diversity. So it does look like there's a link between cardiovascular fitness and diversity. But it's sort of a chicken egg thing.
Right.
Do you have better cardiovascular fitness, because of your diversity, or vice versa? Now, in resistance training, there's nothing really. I've been able to find 2 studies, and if people have other studies, please send them to me, because I'm having a hard time finding stuff. But it just doesn't look like it's really an area that's been explored yet. And
what did they find?
This was there was a study done on overweight and obese women who did curves, which is it's kind of an old, I don't know if it's even around anymore, but it was an interval style resistance training program, and they found that they had reduced endotoxin levels, but they didn't have any they didn't measure the microbiome specifically. Now, these women also lost weight, and so it could be a factor of weight. There was another study that used both resistance training and aerobic exercise training as well. And I want to say that it was a 3 time per week intervention. And we couldn't parse out what was the effect of aerobic exercise versus resistance training. Those people also lost some weight, and they also were supplemented with whey proteins. There were a lot of variables going on, and they found no change in the fecal biome. But it also depends on sort of the sensitivity of the test that you're using, and how many samples you take and how deeply you sequence that to identify who's there. That being said, they just looked at, changes in the profile of what bacteria would be present. They didn't necessarily look at changes in function. Sometimes, and there was a really interesting study, something that doesn't get talked a lot about in the cyclist study, was that they actually found increased activity of a specific archaea. So archaea it's a different group from bacteria. They're kind of similar to bacteria, but this organism consumes hydrogen, it produces methane, and that can actually help increase the efficiency of fermentation in the gut. And so even though 99% of what's in our gut are bacteria, so there are very low levels of other things, like viruses and archaea, the activity of those organisms can be very high. And so it's important to look at not just who's there, but what they're doing. Because you can have bacteria that may be at fairly low levels, but their transcriptive, the transcription of their genes into proteins actually doing something can be extremely high. And so you can see functional changes without profile changes. So where I mentioned, that we don't see an acute change, well, this was a study done in marathoners, and they studied the profile, who's there before and after a race, and really didn't find any changes. And from there we could say, oh, well, acute exercise has no effect on the gut. But we actually found that there was a functional change there. And so functional changes may actually be, something even more important to look at than just who's there. We need to know what the gut is actually doing rather than just who's living in it. Because, we have back when this research was still sort of emerging in the olden days. I don't know, now it's almost 10 years ago. I'm so old. But when I was, just starting to study this in grad school, they characterized an obesogenic microbiome as one that was high in Firmicutes. And so they would say too many Firmicutes and too few Bacteroidetes. That's the problem. Well, the Firmicutes groups contains a lot of beneficial bacteria. Lactobacillus is part of the Firmicutes group. So comparing the Firmicutes to a Bacteroidetes is sort of like saying vertebrates compared to invertebrates.
Yeah.
If you were an alien looking at Earth and you said vertebrates seem to be contributing to pollution on that planet more so than invertebrates, that does not tell you really much of anything. I mean, like vertebrates, you mean your house cat? So that was so general, but that's really what the body of literature said. And now because we've had so many rapid developments, how sensitively and how specifically we can identify bacteria, we know that, that ratio, even though it's something that people still use as a metric, that's really not telling us the whole story. And now seeing that even looking at specific strains of bacteria, now we can get as specific as the species level, even though there's not really technically a bacterial species definition, but we can get very specific and see who's there. We also need to see what they're doing. And also, realizing that because we get so much data out of the gut, I mean, we're looking at thousands of species. Sometimes we have to remove these species that are really low in abundance and assume that they are not playing an important role because they're so low in abundance. But that may not be the case. We may actually just be overlooking things. So even though, we see a few of these similar names in these exercise studies, Prevotella was big, Akkermansia, Rhodetheria, these names come up a lot, but it doesn't mean that there aren't other microbes out there that could be really beneficial and important. We just haven't seen them yet. And so this area of research is absolutely still in its early infancy. And I think then, if I have the opportunity to get back into, doing more research and academia or collaborating, I think the area of resistance training in the microbiome absolutely needs more attention. We just don't know.